Hi, my name is Jamie Hadfield, and I'm with Legends Health, Wellness, and Performance. And today I'm with Robbi Boyer at Xage Medical Spa. And she's a co-founder of the spa, and she's been in business for 14 years. She's also an expert in anti-aging without going under the knife. So welcome, Robbi.
Thanks, Jamie. Glad to be here.
So, Robbi, can you tell us the beginning of about your business and how it started? Because you've been in business now for 14 years, right?
Yeah. This isn't something I ever aspired to. It kind of fell in my lap. I knew Dr. Porter because of other business relationships and because we both like to ski and had that a thing in common. And he wanted to start a spa and wanted a partner, and it sounded okay to me. So that's really how it started. I knew nothing about aesthetics. I knew how to manage a business, but not anything to do with med spa. So he and I both started knowing just about nothing. So that's where we started. It's just taken a long time to learn the aesthetic business, to learn lasers, to learn skincare, and all of those things that apply in this.
So today it's actually a passion of yours, a passion
It is.
of anti-aging without any of the therapies in regards to going under the knife. And so what was the first product that you brought on, and what do you find that's the most beneficial in regards to anti-aging?
The first product that we carried, and the line that we carry the most of now and sell the most of, is SkinCeuticals, and that is a line that used vitamin C and skin cancer as their platform. 30 years ago, the scientist that began all of that research was really passionate about vitamin C and antioxidants and how it could help protect the skin from environmental damage, and skin cancer is what he was mainly looking at. So all of their products have blossomed from that one thing. Sheldon Pinnell was his name, and he's no longer alive, but has a huge legacy for the research that he did.
So I know for 2 years I actually lived in Australia, and I actually picked up a vitamin C serum. And vitamin C, I noticed a huge difference on my skin when I started using vitamin C. It's
such a good, and if you know about antioxidants and free radicals and all of those things that happen in your skin because of environmental things that you do, even sun exposure, you know why vitamin C is so important. It's an antioxidant that helps fight the free radical damage that you're going to get from sun and now all the pollution that's in the air and things like that.
So for those of you that don't know when we say free radicals, so free radicals are really things in our skin, right, in our body that actually could potentially cause cancer or a toxin buildup. And so we don't want free radicals and what's called oxidative stress. When we put our body under physical stress or foods that we eat, that is a bad type of stress, and our body actually starts aging when we're exposed to those things.
Faster, yeah. The other thing that we did that I absolutely loved, the first laser that we had was a hair removal laser and a photofacial. So it did IPL, which is a photofacial, but what it does is target pigment. So everyone has pigment from sun damage. If you live and you go inside and outside, you're going to get sun damage. And in 30 years, by the time I was 50 and started this, I had some pretty good sun damage. I spent tons of time on the beach in the sun with no sunscreen and all those things that probably everybody does. But targeting that pigment and seeing it pull up and flake off was the most amazing thing. I was like, this is amazing that it could even happen. So when I found out what lasers could do, without any surgical intervention, you could use lasers to help start the anti-aging process. I started to get excited.
So is IPL a one-time treatment? Is it a multiple type treatment?
It's multiple treatments. So IPL is intense pulse light, and it targets the pigment. It pulls it to the surface, but it's not all. Some pigment is deeper, and a lot of things, especially melasma, which is a condition. So it's existing all the time in your body. You don't just pull it out and it's gone forever. Melasma keeps coming back. So just like sun exposure causes more and more pigment. So if you stay in the sun, if you stayed in the house and you never went out, or you were in the office all the time, a little bit less sun damage, but you're still going to drive in the car you're getting sun damage on your face. Your driver's side always has more sun
Your
damage
hands
than
are
the
always exposed
your
to the
hands, your
sun.
arm. So those things, if you just exist on the earth, that's what's going to happen.
So at what age, like, right, is it more beneficial to use IPL treatments when we're younger, or is it something that we start when we're in our 40s or even later than that? When is the best ideal time to start IPL?
I think that it isn't an individual thing because some people don't have the hyperpigmentation that others do. So a lot of it's skin type is a lot of times the issue. How much sun exposure you get, how much time you spend in the sun is something. But by the time you're 40, IPL would be helpful for anybody. And then just repeat, like even once a year, a touch up. An IPL treatment, a photofacial once a year would keep the pigment from coming back, or at least it would keep taking it off. It's going to come back anyway. The other thing that is really important to know is that when you get sun exposure, the DNA in your skin changes, and there's something called a thymine dimer. That's when the DNA is damaged from sun or other things. A thymine dimer is something that could be cancerous. That doesn't mean it will be, and there's no way to look at it under any kind of a microscope or anything to say, oh, there's one right there. You can't see it. And so it's genetic, it's environmental, it's all those things. So, but if you pull it out with an IPL, then that risk is gone.
So it's
At
a
least for that.
preventative. It's a preventative from a disease perspective, not only from your skin and anti-aging, it's also preventative in regards to total wellness.
Yeah.
All right, so what about peels, right? You hear a lot about TCA peels and berry peels, and right now we have the vampire facial peel that we've heard about. And so how would I know if I needed an IPL treatment over a
chemical peel?
A chemical peel.
Okay, so chemical peels address pigment in a different way than IPL. So the IPL goes down and pulls it out. The chemical peel helps more on the surface. It penetrates a little. Some chemical peels go deeper than others. So an experienced esthetician will know which one is better. Is it going to be glycolic, lactic, TCA? All of those address different issues. If you're worried about fine lines and wrinkles, there's a chemical peel for that. One of the chemical peels we have is amazing for acne scarring, and helping the skin tones and stuff like that. I didn't believe it actually that it would do what it did until we had two clients. One of them was Dr. Porter's niece, came in with just some issues on her face. She had active acne. It wasn't active anymore. It was just some scarring left over. But it helped even out all the pigment and take that scarring down to just about nothing.
All the pits on
all
the
the
face.
pits and the little purple marks, just the scarring, like the shadow kind of. It wasn't pink. It wasn't active. It had been a long time since she'd had an issue with it, but she still had the leftover.
So I know a lot of people have issues in regards to price, right? They think, oh, I can go one time and that can be the treatment for my face, and they have a difficult time with the reoccurring process, and they always feel like the esthetician or the medical spa or the physician is just trying to upsell them. Can you
I get it.
Speak to that?
Because when I started, then I thought, this stuff is so expensive. How can you, I mean, and they're probably just trying to sell me all this expensive skincare and stuff like that. But I hadn't done anything but wash my face with soap. So I really had no perspective on even what grocery store stuff would do versus what nice, good skincare would do. But because it was available to me at a fairly good price, because I work here, I started using it, and I felt like it was making a difference. But when you look at yourself every day, you can't see that. Then I saw a family picture of us, like our whole family, 10 years before, and then one that we had done recently, and I could see in the picture the difference. And I looked at the picture, I'm like, I had no idea my skin looked that bad, because it had improved. But it was 3 or 4 years of time using a good product. So it wasn't just 2 months or 3 months difference. You'll see a little improvement in 3 months, but it takes a full year of consistent use of good products to to see a difference. But I feel like the products they're more concentrated, so you can use less. They have active ingredients in them, and things at the grocery store don't necessarily have that. They might say there's vitamin C in there. Every product you look at says it has vitamin C. But what?
So how much?
I know.
How much vitamin
How
C?
much and what kind? Because L-ascorbic acid is the only vitamin C that will penetrate the skin. So it can sit on the skin all at once. If it doesn't penetrate, it's doing nothing. It's not going to help you at all. So you need to know what kind of vitamin C. Vitamin C is really unstable. So when you get a product from SkinCeuticals that's $160 a bottle, I'm like, oh my gosh.
Yeah,
but
expensive.
I can make it last 4 months, and I know that it's something that has an active ingredient that's actually going to do something for me.
So would you say vitamin C, like everybody needs to be on a vitamin C? If we were to pick
only one thing,
it would be vitamin C.
Vitamin C makes it. Yeah, for me, that's what made a difference. So I guess everybody else needs it too.
No, and I
like,
can vouch for that because it made a big difference for me. Because
Yeah.
I didn't start really focusing on my skin until I was in my 30s. And when I reached 30,
Yeah.
right, I was living in Australia at the time, and I had applied the vitamin C, and I felt like it helped protect me from the ultraviolet rays when I was
Yeah.
down living in Australia.
Yeah, makes a difference.
Yeah. Okay. So let's quickly talk about, in regards to, you've kind of brought up environmental toxins that are in different types of products.
Yeah.
So when I go to the grocery store, I'm finding alcohol, I've found parabens, I've found propylene glycol, right, which is really a petrochemical, right, that they're putting in
A petroleum byproduct.
Yes.
Yeah.
So, one, can you talk about why they're putting those into our products?
It's an inexpensive filler. It's an inexpensive filler or just a carrier for those things. So the problem with those things are that it's like a Vaseline or a mineral oil or something like that. They clog the pores. So you're clogging the pores. They're not letting them breathe, which is really important. You can wash your face and try and wash it off, but most people only wash their face for 20 seconds. You need a device. Well, I use the Clarisonic device, which it has a timer on it, so you are washing your face for a full 20 seconds. It's for a full 60 seconds. It's like the Clarisonic, the toothbrush, the Sonicare toothbrush that beeps, so you brush your tooth until it beeps, and then you move it. So the Clarisonic face brush does the same thing. It's more effective than using your hands, but it's partly because of the timer, and partly because it is a special technology that helps to remove the debris and the oil from your skins. So, but a petroleum byproduct is just a less expensive way to create a product. So the products that are more expensive, if you look at it, you could buy that product and it will go a lot longer. It has less things in it that will hurt you, and it's just more effective and maybe a little more expensive, but if you spread it out long term, you're getting a better value for something that's really going to work on your skin than something that's not doing anything.
So one of the biggest things that I kind of was an aha moment for me is when I really found out about parabens. And parabens are banned in Europe and Japan. They're not allowed in any of the cosmetic products over in those countries. And when I started studying medicine, and I found out that it really was it halted estrogen, right? So then a lot of people had reproductive issues, and their hormones, especially for women, their hormones got disrupted.
Yeah.
And I was like, well, why are we putting this into our product, right? Why are we putting this into our cosmetic products? And I got angry, really. I got angry at the industry, right?
Yeah.
So can you talk about, in regards to your feelings in regards to the industry? Because I feel like there's so many companies out there that are misguiding in regards to marketing. And I get it, you want to sell your product, I understand that, but there has to be a point where we're doing what's best for us,
for a lot
so we
of,
don't get disease.
We just need to know that a lot of those companies are driven by the bottom line. And so making a product as inexpensively as they can and selling it, and then maybe selling it for a little bit less, is more effective for them than getting good ingredients and making sure that the product is beneficial for the patient and doesn't have anything bad in it. You just have to be your own best advocate. Knowledge is your best defense. You just need to know and study what's important to you. Do I want something that has no parabens in it? Do I want something that has little microbeads in it that are plastic beads that are going to end up polluting the environment as it goes through the drains and things like that? What kind of a micro exfoliating scrub am I going to get? So all of those things, but you just have to be educated. You can talk to other people. You can do your own research. If you don't believe what anyone tells you, and you only believe then you're going to have to do a lot of research on your own to even figure those things out. So if you want to spend a lot of time on Google and try to figure out who knows what, are you even reading something that's from an educated source? So all of those things are really hard. I feel like finding a company that has integrity and knowing that they produce products that are good has been kind of my approach. Even in the supplements that we sell, I know that the things that they put in their supplements are actually what's in the bottle is what's in the supplement, or what they say on the label is actually what's in the supplement. In my skincare products, what's on the label is what's in the bottle. And it's made by someone who is an expert and knows how those things affect us. I tried to study and learn about everything, but there are so many products out there, you can't be an expert on every single thing, or you would be studying 24/7. It's just kind of not possible, I feel like. But if you know what's important to you and you can study those things, at least get a little bit of knowledge about and then you can kind of find for yourself.
So you brought up, from my perspective, you brought up some really interesting points. One was the plastic, right? Everybody has heard about BPA being in plastic bottles. And right, and now you're having to go to physicians and they're going to have to chelate you to remove those metal toxins actually from your body, which chelation pretty much is when somebody goes and claws out the toxins. And studies are showing really that's the only way to actually remove the toxins, and so you have to go up to get an IV and do a series of IVs to remove the toxins, and even the amalgam fillings that we get into our dental, right? Dental, and I personally have 4 of them, right?
I got mine all removed.
Mercury, right?
At a really expensive, it's expensive to have them done, but I had in the olden days, that's what my dentist did. All my fillings were nickel and amalgam. And I felt like I was having migraines and things like that. Dr. Porter just said, you need to get rid of the nickel that's in your, so I went and had them all removed. And he does chelation. I haven't done chelation yet, but that stuff gets built up in your body, in your bones, and it's there. It gets in your brain. So those things are so toxic.
So to me, that, right, if I look at that regards to total body toxic load, a lot of people today, when I talked about a little bit of estrogen receptors, a lot of people today are actually overweight. It's not because they overeat. It's actually because their total body toxic load is exposed to so many different toxicities, right, from lead to aluminum to mercury, that they're holding on to the weight because of the toxicities that they're exposed to. So I want to kind of transfer this conversation in regards to how important is diet in regards to your skin.
I feel like it's huge. And I learned, my journey in learning all that has really been from Dr. Porter, who is a wellness practitioner. He is so passionate about eating healthy and making sure that you don't take in anything that's toxic. So I quit drinking water out of plastic water bottles. So I need to make sure that I'm not adding to the load. I need to make sure I know what I'm eating, what I'm ingesting, eating food that is organic or that I grew myself, or those kind of things, just trying to be a little more particular and a little more particular about the things that I that I eat. You know, what I'm putting in my body is fuel for my body. If I'm eating toxic things or things that are, I mean, and sugar is, it's just about the worst thing I think you can.
8 times more addictive
I
than
know,
cocaine.
it's just awful.
8 times more addictive than cocaine is sugar.
Did you ever, this is what I decided, if somebody in, say, the Russians wanted to take over the world, all they have to do is just get us all addicted to sugar, and pretty soon they could just take over. That's crazy, but I just feel like sugar is just about the worst thing out there. And it's in everything. You have to look in your salad dressing to make sure that it doesn't have some kind of sugar in it besides all the FDA reds and all those kind of things. So I mean, it's just, you just have to be your own investigator.
So a lot of people that have acne, right? There is if you have a leaky gut, which is typically from the diets that you're the diet that you're eating, leaky gut can lead to what I call leaky skin. I know that's not very medical, but right? But when we're talking about, and I know you have a therapy here for acne. Can you talk a little bit more about that?
Or the acne treatment that we use is, the topical things that we use are things that are pretty common in the industry, benzoyl peroxide and the salicylic acid face washes and things like that. But Dr. Porter likes to treat it from inside as well. So we recommend probiotics for our patients. We have an Acnetrol, like a supplement, a vitamin that has vitamin B. B is really important for your skin. It also has zinc oxide and a vitamin A, but it's an actual vitamin A. It's not synthetic, so it's not like Accutane, but it helps. So it helps to fight the issue from inside as well as topical things that you're putting on your body. So we have a laser that helps to kill bacteria. We have a Blue U and Levulon treatment that helps to shrink sebaceous glands. So all of those things are different ways that you can treat acne, either whether it's a teenage or adult onset. And they're all sometimes different things. Some people get it from stress. Adult onset acne is sometimes from stress. So we have to find ways to
how
help.
to rest and relax and how to de-stressify,
mediate the stress, and then work on how to clear up their skin. And that's easy if you can figure out the stress.
Yeah, a lot of times we don't want to admit that we have stress.
No,
actually.
no.
Yeah. All right, so you also do anti-aging injections, right, and fillers here.
Yeah.
So where do you think those fit in?
I feel like there are a lot. I mean, everybody's heard about Botox. There are a neurotoxin that helps to compete with the proteins for the synapses. So when the muscles contract, that neurotoxin that we're using competes with the proteins that your muscles are using to contract, right? So that is just helping you to not create wrinkles as fast as you would without it. It just depends. But the other thing neurotoxin does, especially Botox, you'll see ads on the TV for Botox for migraine headaches. There is a treatment for migraines. There's a treatment for TMJ with neurotoxin. So there are other things besides just vanity that it's helping with. But
it also helps with sweat, right?
Yeah, hyperhidrosis. So if you end up with so much perspiration that your clothing is wet by the time you walk out the door to go to work, that's a thing that Botox can help. The other injectable that is really awesome is an HA filler. They are injectable fillers that help replace the fat pads that we have when you're young. It's all nice and plump and cute. As you age, those fat pads diminish or they start to move. You have bone loss, so all of that structure that's in your face is starting to slowly go away. And so fillers are a way to help to replace and replenish that look.
So I actually have
a little chart.
A little chart that actually kind of shows this. So when we're young, we actually have fat pads into the face. And as we start aging, we lose those fat pads. So hyaluronic acid, when we're actually putting filler into the cheeks or we're doing lip injections, we're actually filling back that space where hyaluronic acid actually
the hyaluronic acid will help to fill, especially one of the first places we add filler is on the cheek. Also in the bone area right here, you can see There's more bone here along the jawline and right under the eye. In the next picture of the aging face, the jawline has changed, and so has that structure around the eye. So those places that were holding up the fat pads that are gone, the bone is now is diminished too. So what was the foundation that was holding that stuff up has changed. So
women, this is when we start to jowl, right? So you still have the same amount of skin that's actually on your face, and so the skin starts to come down and heavy, right? And we start to get what's called nasolabial folds. We get marionette lines, and we start to get jowls right here. And so this product, we want to make sure that the center of your face, right, when we're looking at your face, that the widest part of your face is right here, and that we're looking up. And so that's why we usually try to make I call it a Nike swoosh.
Nike swoosh, yeah.
On the cheek.
Yeah.
On the cheek.
Right, just that little Nike right there. And that's the first place to start with fillers. Then you can, they call it chasing lines. But if you see folds here, and that's where you put filler first, it's going to add an abnormal volume to your face that wasn't there in the first place. So chasing lines is a little bit outdated way to look at using fillers. You want to actually start replacing the volume that you've lost here. So when you were young, that cheek space.
So I'm going to actually show you an example right a little
here.
bit on your face, right? So if I can,
yes.
right?
Yep.
So if I bring up your cheek this way, right, and I hold up her cheek this way, do you see how this raises that nasolabial line and actually carries up her marionette lines
and it helps pull this up too. So
it
all of that
up.
is, yeah.
So you actually use less product. You actually use less product when you're...
And you get a more natural look. You don't have filler everywhere where there wasn't volume there in the first place. It's all up here, and then you can see hollowing later. I've started to see some hollowing in my cheeks, but I'm 65, so that's the loss of all these fat pads are gone now. Well, not all, but they're starting to go away.
Doesn't
anyway.
she look great for 65?
For 65.
All right, so let's kind of quickly, right, for the viewers, let's just kind of talk about age groups. If you're in your 20s, what should you do? If you're in your 30s, what you should do. So, right, in regards to a skin treatment, a protocol that somebody should do.
Okay, when you're in your 20s, just a few basic good skincare products. A good cleanser that's not going to dry your skin out, but that helps to remove the oil and the debris from the day. Makeup if you use makeup. And a good moisturizer, something that has hyaluronic acid in it. Some girls think, if they feel like they have oily skin, just a hydrating B5 gel that has no other moisturizing component in it except hyaluronic acid and niacin. So vitamin B and hyaluronic acid will help maintain the youthful look and help with fine lines and wrinkles and things like that. We live in a really dry, arid climate. Utah is an arid and dry. Dry. The wintertime is awful because the cold air, besides the dryness, makes your skin dry. So in your 20s, just some basic good products. Then as you get older, when you're 30, you might add an eye cream, something for around the eyes where you get those fine lines and wrinkles around the eye, something that has some peptides in it and things like that will help with, and a retinol. Everybody should add a retinol. By the time you're 50, you should be using a retinol. Retinol makes your skin act younger. It helps to the exfoliation process. When you're in your 20s, your skin exfoliates every 28 days. By the time you're in your 50s, it exfoliates every 45 days, which means that fresh look where your skin, if your skin has if you've got dead skin cells on your face, the light doesn't reflect and it looks unhealthy, doesn't look good.
Also, this is where I'm going to promote bone broth. For those of you want to actually make your own bone broth, because bone broth actually helps stimulate the collagen, natural collagen.
Or some kind of a collagen supplement.
Yeah.
We also carry a collagen supplement that has collagen peptides in it, collagen types 1, 2, and 3. So a collagen supplement, especially for people who are active, is really like urgent, essential.
Okay.
Important.
Now, I've talked to several women that are maybe probably late 50s, early 60s, right? And they're saying, right, they're coming to me and they're wanting to do, here at Xage Medical, I actually do the anti-aging injections, the fillers in the cheeks and the lips. And I have several of them ask me, they're like, well, should I spend the money on the injections, or should I actually, is it time for me to go under the knife? So can you address that?
I guess I feel like that's a personal thing, but there are a lot of things you can do if you don't want to go under the knife. There are a lot of injectable things. So if you did, we also have a laser called All Therapy that is actually FDA approved for skin tightening and lifting. So if you can tighten and lift and then fill and replace the volume with fillers, I feel like that is, for me, that was a better option than a facelift, because I'm looking at downtime, at least 2 to 6 weeks. So there are a lot of, and there are risks when you do surgical things. And this doesn't bother me enough that I want to take risks. Those risks, there are no risks with lasers, and with these things that I know of, we're really, really careful with our lasers. We don't do anything that's not approved in the protocols that they give us. So, and all of those things are just really safe. Fillers are safe.
What about Sculptra? We hear a lot about Sculptra.
Sculptra Aesthetic is really an interesting product. It's poly-L-lactic acid. What it does is stimulate collagen. So you put it in, and then you get to wait 3 to 6 months to see any improvement, or to see the improvement. It's slow. When I did it, the first thing people would say to me is, wow, your skin looks really good. What did you do? But so it's helping to rejuvenate the skin underneath. It makes your skin look better because it's starting to stimulate and rejuvenate. Then the collagen starts to rebuild, and you get a increase of collagen in the skin. But it's a slow process because collagen takes time to rebuild. So it's not in 2 weeks, or when you walk out of the office, you're not going to see a difference. It will be 3 months before you see something. But it's pretty awesome. And it's not, a lot of people like it because it's slow and gradual. So you're not going to walk out of the office with full cheeks and all of that stuff. It takes a little bit of time. And so no one that you know would even say, oh, I see you did something. What did you do? That it's just not that obvious. But it's just as a slow process, and it helps rejuvenate the skin. It's pretty cool, actually.
That is cool.
Yeah.
That is really cool. So out in front, you have a bunch of the nutraceuticals, and one of the products that I noticed that you had was CBD, right?
Yes,
you actually
CBD oil.
She actually carries the Legends brand of CBD.
Yeah.
And so, one, can you address, because before I even walked into this office, Xage Medical was carrying CBD products. So can you tell me why Dr. Porter uses CBD from your perspective?
He has a lot of patients who have chronic issues, or dealing with pain and things but don't want to use any opioids or other over-the-counter pain meds. All of them have some kind of side effects. Even if you use Celebrex long term, it's going to be something that has other bad
it
other side effects.
vitamin B12 and CoQ10. It depletes nutritionally.
Yeah.
Any pharmaceutical actually depletes the body from some type of nutraceutical standpoint.
Yeah. So he's using that to help people manage their pain in a way that's not detrimental to other things. So we have a lot of patients who are using that instead. They also, we use with the CBD oil and curcumin supplements. Those things can really help to make it at least bearable.
Well, they're very strong anti-inflammatories.
Yeah.
So recently, I've read a lot of different topicals or information on CBD and topical CBD. So what they're finding from the research that I have seen is we have an endocannabinoid system throughout our body, but we actually have a lot of cannabinoid receptors on our skin. And so if a product, it was interesting, and we'll be doing a podcast with a beekeeper. And so what I've recently found out, right, in regards to beeswax, right, which is a natural product, right? If you use beeswax, it stays on the top layer of the skin, where the actual CBD can help all of the psoriasis or the eczema or any type of skin condition.
Or acne as well.
Yeah, and I really wish I would have known that for my viewers. You know that I had what's called chronic idiopathic urticaria, and I suffered with hives every day for 10 years. For 10 years, I woke up with hives every day. And I wish I would have known about CBD, because it would have helped stop the itching. It would have stopped helping the pain. It would have stopped the nerve and because it helps. It's neuroprotective, right? CBD is actually neuroprotective, and I really wish I would have known about that product back then.
Back then, yeah.
Right.
Yeah.
So, yeah. So, is there anything else that you would suggest to our viewers in regards to anti-aging?
I feel like there are, for anti-aging, the most important thing, especially for women, is as a routine amount of exercise and eating a healthy diet, making sure you're getting, so hormone replacement at the right age is going to help you. Sometimes I used to curse estrogen, but estrogen is the fountain of youth, and you need to have those hormones, all of those in balance as you go into menopause. So find out, get a hormone balance, find out what your norm is, so that when you start getting more than depleted, at least you know what your normal estrogen or whatever balances were in the first place. But try to keep those hormones balanced. Eat a healthy diet, be active, and get enough exercise that your bone density and your muscles are supporting you. Just all that.
Great.
And add some skincare and lasers on the side, right?
Well, if any of you have any questions about skincare, I invite you to come down and speak to Robbi and her staff at Xage Medical. And thank you, coming from Legends Health, Wellness, and Performance.
Thanks. It's been awesome.
Thank you for watching this podcast with Legends Health, Wellness, and Performance. If you are interested in the more podcasts, and especially the one with the beekeeper, you can find us at legends_health. And then if you want to look on their website and you actually order CBD products, you can go to legendshealth.net. And Robbi,
Yes.
Where can people find you? Where are you located, and how can people find you on social media?
We're located in Provo on University Avenue, but we have a website, xagemedicalspa.com. All of our social media is Xage Medical Spa, so everything is under. So we have Facebook and Instagram, a lot of pictures on Instagram of before and afters of procedures, a lot of the filler things like Dr. Porter did a couple of nose jobs that are pretty amazing, just with filler. It takes 15 minutes to get rid of a crooked nose and make it straight and cute again. Some of the other lip fillers, injections that you've done. So that's a place to see some of those treatments, but you can see everything we do at xagemedicalspa.com. Or come in the office and get the CBD oil off the shelf.
And where are you located, your address?
3650 North University Avenue in Provo.
For those of you that are not in Utah, you can find us at the websites, and please reach out to us. And thank you for watching, and we look forward to you watching the next podcast with Legends Health, Wellness, and Performance.
Great.